in class. We have 3 more tokens to go. We have 3 more tokens to go. Okay, what is your name? You know, if the child is able to respond the name. Oh, excellent. Saying your name, you give another token. How many tokens left? 2. Okay, can you write number 20 for me in the book? And immediately write 20. Oh, good job. You have another token. Now you have 1 more token. Touch your nose. Then the child touches. Okay, quickly go outside and play. You see. So these are the strategies you can use for the child, because we don't know maybe what happens before the behavior. Maybe the child is exhausted, or he has stayed on task, or maybe he doesn't understand the particular thing you are trying to teach him, or maybe he's struggling. He doesn't like a particular subject and he needed a break, and he doesn't know how to say a break. But we cannot give him a break to go outside immediately. First, we need to make him do some work, even if it's just to write just anything at all in the book. We don't need to make him stay long to do some work, to stay on task. It's not compulsory he has to finish all the tasks, because at that time he's exhausted. So he needed to what? Maybe he needed some time out. But first, we need to make him understand that he needs to do some work. He cannot just go outside to play. So you have to use the token economy board, or the first and then board. So I hope I've answered your question. I hope I've answered your question. Is Madia here?
Yeah, Mary, I'm here. Okay, so the next question is, are there any specific speech or language difficulties that are associated with ADHD?
Am I answering that, or you want to answer that, Madia?
Yeah, sure. Go ahead, Mary.
Okay. Are there any specific speech or language difficulties that are associated with ADHD? Yeah. Usually we have different kind of speech, language and difficulties. So just like what Madia said, we don't know which one you are particularly asking. But yes, they are associated with ADHD. We can have a non-verbal child and a verbal child, but yet he has difficulties in on how to read. So there are some specific speech, language, and difficulties which can lead to they call it kohila. Those things are language barrier difficulties. So yeah, and then all these things, all this speech delay, specific speech delay, language difficulties goes down on autism. You can have the speech delay, non-verbal or verbal autism. You can have speech delay with ADHD as well. So they are all interwoven and they are associated, very, very associated. Usually what you do is to go and check with your speech therapist. If you have any speech therapist, you can just get them assessed to know which area of difficulties they have, because we have different kinds of speech delay. We have the language barriers, we have communication barriers, so we cannot say which one is you actually you want. So it will be better for you to speak to a speech therapist or a speech practitioners for that. Is there any more questions?
All right. Yeah, just let me have a look. Okay. Pola Shade. She has asked, you mentioned meditation. Can you please give some specific examples of meditation they can engage in?
Yeah, we have yoga. They can practice yoga. They can practice time out, going outside to work while they are working. They can meditate through their minds, understand? So they can also practice, sitting down, meditating on music, listening music. Meditation can also come to when you listen to music and not ocean wave music, actually. So they can also practice mind meditation through that. It's to calm their nerves down, to calm their minds down. So it can also work as well for meditation as well. So breathe in, breathe out as well. You know, it's also part of meditation. When you ask your child to breathe in, you set a timer for 5 minutes, then you do a breathe in, breathe out exercises. You know, all these things help as well for meditation. So we have breathing and breathe out. We have yoga practice. We have taking a walk, listening to music. So those are the exercises we can practice for meditation.
I would
Anymore?
also like to add what Mary said, that you could also use sensory toys, sensory activities, sensory toys. These all will be really helpful for a child. So, yeah, moving on, the next question, again from Fola Shade. If a child is having anxiety and doesn't focus on his studies, what should be done? Mary, would you like to answer the question or?
Okay, if a child is what?
So if a child is having anxiety and doesn't focus on his studies, what should be done?
Again, we need to know why he's not focusing on his studies. Anxiety could mean a lot. A lot of things going on in his mind. When a child is having anxiety to do some certain things, it tends to be very difficult to even study at that particular time. So what should be done is to engage in different activities to do. You can do painting, you can read stories for him. You can do painting, you can read a story for him, just to bring him check. And then you can also give him a time out break, just for relaxation of the mind. Because when you have anxiety, it's very difficult to study at that particular time. So parents should be patient and understand that there are some certain times that you don't need to force the child to study, but because of if the anxiety is not being dealt with, and that can also lead to mental disorder. Yeah, in the mental disorder, we have post-traumatic stress disorder, we have anxiety and other things. So um, those are the things, and in this aspect, you don't need to force them to do some certain thing. Rather, you can just give them some things that they enjoy doing most, and then role play with them. What I mean by role playing with them is like they engage in some particular thing. You can just teach them some few things that you need to teach them. Not necessarily they have to sit down, hold the pencil and write. So because you know they are actually going through PTSD, post-traumatic stress disorder, and it falls under the same category: anxiety, panicking, and depression. So their mental health is not really regulating at that particular time. So you don't need to force them to study, but rather you can role play with them, let them practice what they enjoy the most, and then you can use it to ask your questions and then make them feel happy, giving them a lot of breaks, So because we don't want to add to the behavior, we don't want them to feel agitated. So you don't need to force them to study when they are having issues. So if that is not properly managed, you can speak to your um, cognitive behavior therapy, for mental health, child and adolescent mental health disorder. So you can speak to them about it, like what they need to be done, because that is in another department of the psychologic part.
Yeah, so like Mary said, we don't know what that for anxiety it's like an umbrella. There are a lot of things that fall under
Yeah.
anxiety. So we need to identify why the child is feeling anxious, first of all. But in general, you can always modify his activities to make him study. Now, the typical worksheet method, the black and white worksheet, that does not work with all the children. So what can we do? We can simplify the questions. Maybe if the child loves music, ask the questions in a musical way, keep it in a rhythm, or do some arts and craft with the child. For example, let's say the child is in year 2, and the child is learning nouns. So we have name, place, animal, thing. So the child has never learned this before, or the child has never got the concept of this. So how you can teach the topic nouns to the child would be that you can give some pictures. So under nouns we have name, place, animal, thing. So you can put a picture of a girl or a boy and give the names of the girl or boy: Jake, Amy, Natasha, these kind of names, some animals name, places, things, and put the pictures related to those things, or related to those places, related to those animals, and for a feminine name, a girl, and for a masculine name, a boy. And then you can give this to the child and you can explain to the child. Go in a slow, smooth method when you're teaching the child. Explain to the child. So the name is like what you and I have. Your name is, for example, his name is David. So your name is David. You have a name, David. My name is Fatima. I have a name, Fatima. So this boy has a name like this. This girl has a name like this. Now this is an animal. Who is this? So the child might be able to identify. So if it's a lion, this is roar. Or if it's a if for example picture of a cow, this is a cow. Moo. So you can make such kind of activities which will engage the child, and the child's interest will be dragged to that activity. So not only is the child enjoying the activity, but the child is also learning. So, but the first thing you need to see is, why is the child having anxiety? What is the cause of this anxiety? So that's the first thing we need to find out. And accordingly to that, we can help the child with his studies. Moving on. Yeah, Ansa, we'll be sharing the WhatsApp number as well. Yeah, that's about it. I would love to continue, but there's also. Yeah, so that's all of the questions. I'll be sharing a Google form on the meeting chat. I hope everyone is able to access it. So the remaining of you, please do open the form and fill out your details so that we can share the PowerPoint and any notes that are available along with the recorded meeting. So you can go through it later on as well. So please do open it up. And also, I hope my screen is visible to everyone. So I have included Abiosola Mary's email ID. So please do take it down, or you can take a screenshot. And then my name is Madhya. I am the founder of Gifted Hands. So you have my name here and my email address along with my WhatsApp number. You may drop a hi now and save the number, or you can message on our emails. Whatever questions you all have, please do not hesitate to ask. You may ask as many questions as possible, or if you wish to learn something in the future, please do go ahead. You can request for the topic and we will work something out to meet your needs. So I hope everyone has taken this thing. So I'm waiting for the responses. Once the responses are done, we can conclude the meeting. Until then, I'll give you all a brief insight into what Gifted Hands is. So Gifted Hands is an organization where we cater to the needs of special children, special needs and disabilities of both children and adults. We also focus on equipping practitioners and parents with the necessary strategies and concepts to individuals out. So we are not only going to be hosting webinars, we'll be moving forward with seminars, trainings, events, workshops that will all benefit both the individuals of determination and at the same time the practitioners and parents. We have a variety of practitioners ranging from therapists to counselors, senkos, and yeah. Okay. Oh, okay. So questions can always be asked, especially to this WhatsApp number that's provided. You can always drop a question on if you have any questions or what you would like to learn in the next session and such. We can cater to your needs. We can or we can create a forum whatsoever cater to your needs. So please do fill out the Google form, and we'll be sharing all the documents and details to you once it's done. All right, so let me just put this here. Okay, great. I see 7 responses already in. Please, the remaining of you, please do. Oh, me, MIH. Okay, you cannot find a WhatsApp number. Okay, I'll just send it to the meeting group as well. Okay, I hope it's visible to everyone. Yeah, okay, great. Okay, we have Rofia. She has a question. Mary, are you here? Is here? Pattern and attention and attention. Uh, I think Mary is not answering. So Rofia, I'll answer your question. So what strategies or techniques can be used for retention and attention? Now, when a child is lacking attention, what we can do is, like I had answered in the previous question, we can always simplify the question, the activity, whatever the task is given to the child. So, for example, like I had given the example of nouns, make it fun for the child. Now, these are children, and they, due to certain disabilities in the brain, they are unable to gather these informations at once. So what we can always do is simplify the activity, make it fun. Now, as adults ourselves, we cannot sit in a session for 2-3 hours, and like for an entire day, we cannot sit in a session, listen to each and everything our lecturers are telling us, right? Each and every instruction that's given to us, we cannot follow that. We get frustrated, even as sound adults. Now, definitely when you consider a child, get into the child's shoes and consider the child, think in the child's perspective. Definitely, the child feels overwhelmed. The child does not like being continuously told what to do. So, how you can help this child is by simplify. See what he or she likes. If he or she likes music, make it in a fun musical way. If he or she likes arts and craft, involve them in the activity that you're making. Not only this will this increase the attention of the child, but the child will also be learning while he or she does the activity. So let's say you're teaching the child the multiplication table. So you can take some printouts of the timetables, for example, 1 to 5, tables of 1, 2, 3, 4, and 5. And then you can ask the child, can you help me out? So the child will be more than happy to, because when they see, keep in mind, whatever the activities that you are doing must be colorful. It should not be a neutral color, should not be black and white. It must be colorful. This is to make the child get interested into the activity. So you can ask the child, can you get me that scissor, please? So see, but when you look at stationery that might be that might cause harm to the child, for example, scissors, just make sure that the child is not at a position where he or she would harm themselves. So if he or she is in a mind where they handle the stationery carefully, you can ask the child to get these scissors, and then if they are able to cut properly and such, you can ask them, okay, you cut this this paper sheet, I'll cut this paper sheet. So the child is getting engaged, and also at the same time they are getting interested. Now this will eventually, it will increase the child's focus and get the child interested into whatever it is that y'all are teaching. Okay, so I hope I've answered your question, Rofia. Yeah, Mary is busy. So is there any more questions that would like to be answered now in the session? I'll be concluding the session in another 5 minutes. So if any of you have any other questions, please now do ask.
Hello.
Hi, Gillian. Gillian.
Hi.
Yeah,
I was asking like this because today session has been very nice. Thank you for arranging everything, and
sure.
it is very informative. So I would like to get like all what you've discussed, because I was in the beginning I was not like very, I was busy some parts. I came in later. Like I would like to get the whole everything discussed today.
Definitely, definitely. We will be sharing the PowerPoint and the screen recording. The meeting has been screen recorded. So that
Yes.
will also be shared to you, which is why I would request you to fill out the Google form so that we can share these with you once the session is done. So I
Okay.
hope you
Thank you
have
very
filled out
much.
it. Yeah, and you also have my WhatsApp number and email address, which has been shared to the group. So
Yes.
if you do not receive it, please, you can drop me a message on that as well. These all will be shared to you. Definitely, these all will be shared to you.
Thank you very much. It was very helpful.
You're welcome.
Yes.
Rofia, yeah, and retention, please. So now retention basically means continuing to have an act continuously, means continue to have something. So how can you reduce retention? Um, that now again, this depends on exactly what we are looking at. You have to let me know exactly what is the child being retentive towards. So general explanation, a general advice I would give is let's say the child WWD. Let's say the child is continuously, again, I cannot give a proper, I'll be honest with you, because I cannot give a proper answer to this without knowing the exact scope. So, Rofia, I would suggest that you drop me a message with the exact details. I'll help you out then. Just drop me a message with an exact detail, because I don't want to misguide you with the improper information. So do drop me a message either on my email or WhatsApp. I'm available whenever, and I'll get back to you. Drop me a message with the exact details, and I'll get back to you for sure. Okay. Paula said, can we use ABA methodologies with ADHD children? Yes, definitely you can do that, because most now ABA is applied behavior analysts. So definitely ADHD children do have a requirement for ABA. So when we are working with ADHD children, some may portray negative behavior, which could be hitting, pinching, punching, kicking, these kind of things. So the methodologies that you use, always keep in mind that it should not just be a random method that you're using on the child, or it should not just be something that list of ABA methodologies that I've learned about or I've heard of. I'm going to implement this on the child. It should not be that way. You should first take some time, sit with the child, understand the child's reason for the ABA implementation, why we need to implement the ABA implementation strategies on the child. Understand that, and then write down the methods, the strategies, ABA most likely to be used with the child, and then begin implementing it. All right, so does anyone have any more questions? Please do go ahead and ask if you do. Okay, anyone else have questions? So in that case, then I'll be okay, then
Yeah,
I'll be
please. Excuse me, please. Can I say something? I cannot type because where I am, my hands are tied. I have a student, he's not viber, he likes activities, he's
I
friendly.
cannot hear you.
Can you hear me now? Can
Yeah,
you hear me?
yeah, it's
Okay.
better.
My present
Yeah, Tessie,
student,
I can hear you.
okay, my student is not viber,
All right.
he cannot communicate, but he can do his activities in the class and he's friendly. But the only issue I have with him, he does not want to do anything academic. In the classroom, when they are writing, he does not want to write. And then when you try to make him write, he screams and screams, and then he's distracting other students. So the only way I can make him write is to take him to the sensory room. And immediately we're almost at the sensory room. He knows I'm going to make him to write. Then he's going to scream for like 15 to 20 minutes. Then he's exhausted with his screaming. And by the time he's screaming, I'm trying to calm him down. He's screaming and looking at me. There's no tears coming out, like he's throwing a tantrum. And he's looking at you and he's screaming so hard that will make you frustrated and you want to make him go out. But after a while, if I ignore him, then he will stay calm. Then I'm trying to hold his hand for pencil grip so that we can be able to do something. Am I pushing him too much or I'm doing the right thing?
Okay, so Tessie, I would like to know first, what is the child's diagnosis?
The parents refuse to tell me actually. They just said he does not speak, he's not communicating. That's what the parents told me. But with what I see, I know the child has a little autism, and he's not violent anyway, but just that he's not interested in academics. But for
Okay,
every other thing, it's perfect.
yeah.
For every other activities in the classroom, it's perfect. Even though he does not want to do coloring, nothing, anything academic, he does not want to.
All right. So, and how old is the child you're dealing with right now?
He's 6 years old.
6 years old. All right.
Yeah.
So, according to what you have, you had what I understand is the child most likely in the spectrum autism, ranging from probably mild, moderate, severe. So I would suggest that you urge the parents to get the child assessed by a center or by the psychiatric department in the medical centers, so that it is not only is it easier for you to understand what exactly is the child's requirement, but also for the child to be able to regulate his emotions. Now, what you can do when it comes to his stubbornness, I would say his stubbornness, towards the academics. Is he in the nursery or is he in the school?
It's in the school, like nursery too.
All right. And okay, so if he's attending schooling, how is he during his pull-out sessions with the inclusion department?
Same thing, but I think I started applying what the inclusion department was doing with him. Same thing, whenever they pull him out for in the sensory room, he scream and yell for like 20 minutes, then calm down to do any activities he wants to do.
All right. And why do you think that he is unable to sit in the class and follow the same activities as the other children?
He does not want to, because anytime I try to, he scream, and he has this very loud voice that will make other children scared. And then the teacher is like, "Oh, you can take him out, take him out." He cannot sit down for 2 minutes. Is when they are writing, he's walking around the classroom, but he does not cry. He does not yell at that time. But immediately you want him to write in the classroom, then he's screaming so loud that other children are very uncomfortable.
All right. And has he had a LSA before?
Yes, I'm the fifth one with him.
Okay. So first thing is this now this child, the first thing in his mind is that he can understand there is someone who will sit with me and make me do the work. That frustration. That's the first point we need to know. Any student of determination, when an LSA sits with the child, the first thing that comes to their mind is, okay, she's sitting with me, she or he is sitting with me. This is my
पेड़ रही है ना निम्रा मैं चीज मंगा के खा तुझे नहीं मिलते मैं पक्का मंगाऊंगी मैं कहने लगी तुझे नहीं मिलते
okay. So so when you look at the child's perspective, the first thing that comes to the child's mind is this person is sitting with me. Now, why is this person sitting with me? Why doesn't this person sit with the other children? But why is this person sitting with me? That frustration that's the first thing that comes to the child's mind. Because, and then slowly, gradually, after a week, the child understands that this person is going to make sure I complete my work, is going to make sure I study in school. So that is there. That because definitely when there was no LSA for the child, just have this conversation with the teacher. Any of you who works as an LSA, have this conversation with the teacher, class teacher, subject teachers of that child, and ask them, how was the child when there was no LSA? Most of the time, what they'd say is, when we try to make the child do the work, sometimes he did, sometimes he didn't do. Or sometimes they might say, child did not try at all. Now suddenly his tantrums are increasing. Now this will be mainly because of the reason that the child has understood your role, the reason you are there for him or her. Second thing is, if the child is very reluctant to write, try to understand why is the child reluctant to write? Why is the child reluctant towards academics? Is there a reason? Is he feeling is there, like, for example, if he's unable to understand the question, is that why he's throwing a tantrum? Or does he know how? Try to understand the reason behind the child's tantrums. So this will allow you to modify the activity to help the child. The third thing you can do is see what the child enjoys. For example, let's say the child enjoys art and craft. So make the activities in such a way to at least till you get the child to the right part, at least till you get the child to follow the academics. Make activities that are interesting, that are very eye-catching, very colorful, very that has stars on it, shiny things, these kind of things that will make the child so interested in the activity that he or she completely forgets that they're going to study. But according to them, they think that we are going to play a game. Use this terminology. We are going to play a game now. So instead of saying, come, let's study, use the terminology, shall we play a game? See, I got this for you today. Shall we play this game? So talk in a very friendly manner, in a very make the activities also in such a way that the child will actually be interested to do these activities. So you can do this and at the same time reward the child, praise the child, reward the child. Even start off because you need the child to understand, to cope with you. Start off with even the smallest thing. If he manages to write 3 words, even immediately be, oh wow, very good, good job. Whatever the child's name is, Daniel, Esther, whatever the child's name is. And then, wow, if you complete this sentence, I'll give you a star. So motivate the child throughout the lesson, throughout the activity, motivate the child, praise the child, motivate the child, and then give him a star, give him a stamp, or give him let's say maybe any sticker or such that will make him want to follow whatever it is that you're telling. Now, definitely this is going to be difficult because I'll be frank with this is definitely going to be difficult in the beginning, first few days. So slowly, gradually, maybe the first day he might do it. He might, with the rewards and all, he'll be happy. He will listen to whatever you're telling. Then after 2 days, he'll start throwing his tantrum. Again, the next day he'll be fine. Then after 1 week, he'll start it again. So when there's a fluctuation in his tantrum, it is you are going on the right path. That the child is coming to the right. In his way, he is coming to the right path. So you can follow this method and see. He is right for the first few days. Try consequences part. Yes, do offer, but at least days show him that yes, if you do well, you get this, you get a reward. But if there is negative behavior, I am upset. Use the terminologies that will make the child understand. Tell him, I am feeling very sad. Express it. I'm feeling very sad. Look what you did. You're not ready to study. I'm feeling very sad. Mention his name. Do you want me to be sad? Am I not your friend? Get into the child's shoes. You have to, for these children, we have to behave like children to make these children understand what we are trying. And then later on, he will understand that you want what's best for him, that you are trying to help him out, and then automatically he will start listening to you. So this will take some time. This might take even a month. So we have to be very patient. We have to be very patient, very understanding towards the child, and we have to work with the child. I hope you've understood that, Tessie.
Yes, please, I did. Actually, everything you've said, I've tried all that. But it's fine. I will keep pushing, okay? But I was just asking a question. Should I let the child be? Because I actually spoke to the class teacher, as in the writing. The teacher said he has never written anything since he came to the class. That I'm the one trying to even make him do something like every other LSA with him, do not push too much. So that she's really impressed with what I'm trying to do. So, but I think I was just asking, should I let the child be since he's not interested in writing? Should I let him be? Is it the right thing to bring a child to school? He just does the other activity and play and goes home. Is that the right thing to do as a LSA?
Okay. So now the first thing is letting the child do his own thing. Don't you think it's like giving up on the child? Because yeah, so first thing is the child, he's throwing tantrums. He wants to do whatever he is. Maybe because the previous 4 LSAs, they might is that you want. Means there comes a point where even as a LSA, you will feel frustrated. You will feel like, why is this child not ready to listen to me? Why is this child not seeing how much effort I'm putting on him? Yes, definitely, I can understand your situation, but can the child understand this? No, the child cannot understand this. So instead of giving up, what we can do is when we are feeling frustrated as adults, simple thing we can do is withdraw from the child for 2 minutes, go to the washroom, take some deep breath, take a walk, come back in, work with the child again. But never ever give up on the child, because if you give up on the child, this would not only will this allow the child to will not only will this allow the encourage the child to throw more tantrums, because he can understand that, okay, she has given up on me, I can do whatever I want. This comes into his mind. Now we don't want this. And maybe now you said the teacher has said that the child has never written before. Maybe the child does not know how to write. Have you ever considered this, that the child could possibly not know how to write? Maybe he's finding it difficult to hold a pencil to write, or maybe he's feeling overwhelmed that there are many children, because this is a classroom environment that we are talking about. So maybe he was previously in a school readiness program in the special needs center, or maybe he was in the nursery, or maybe this is direct admission into school. So maybe he is unaware of the fact that maybe he's frustrated actually. Maybe he's frustrated that there are many children. I see many different faces, because in the sense that the teachers are continuously changing for each period. Maybe that frustration, maybe that overwhelmness. So what you can do is, don't give up on him. Don't let him do whatever it is that he wants. Because letting him do whatever it is that he wants would not only put your efforts in vain, it will encourage him to throw tantrum, which would in the future lead to developmental delay in the child. So this will, now he's 6. Maybe now just letting him do whatever it is that he wants will be relaxing to us, but for him, this would affect his future. So what we can do is sit with him, ask him to, sit with him, ask him to try different activities. Now, for writing activities, what you can do is, I would suggest you give him a cotton Q-tip, the cotton buds, right? Dip it in paint, give him a colored paper, and tell him to make designs. So make him do different activities that he might enjoy. For example, if he likes music, tell him you will take him to the music room. If he writes at least a date, let him write the date. Okay, very good. You wrote the date. The next day, can you write the date and the topic? See, if he's able to write, you can do this. If not, gently hold his hand and make him write it. This will not only motivate him to follow whatever it is the instructions you're giving, but also to it will upbring him. So never give up on a child. Yes, it will be frustrating. I've been in your situation before. I can understand. The child might hit, the child might cry. It will come to a point where it gets so frustrating that you feel like your efforts are in vain. But we have to have, as practitioners in this field, we have to have patience. The child requires patience, and we have to have a character of us that we are resilient. We will never give up, because we need to show this to the child that you can throw tantrums, you can do whatever it is that you want, but I will never give up. You cannot try this with me. Show this to the child, and trust me, it will take some time. Yes, it will take some time, but he will come to the right path. You show him that he cannot take advantage of you, because maybe he may be thinking that she's getting tired of me. I can take advantage of her and get whatever I want. Show him that's not going to happen. Show him that no, you are not going to listen to him, that he has to listen to you. So if he listens to you, yes, there are activities, there are rewards. Show him this, and definitely he will come to the right track. But might take some time. It might take few weeks. It might take a month. It might take 2 months. But show him that he cannot take advantage.
Yeah, thank you so much. I appreciate this. God bless you.
So does anyone else has any questions? All right, so I don't think anyone else has any more questions. I'll be concluding the meeting. I hope everyone has got I'll just share the email address and WhatsApp now. You can call me as well. I'm available both on contact and on WhatsApp. you can get in touch with me. Me, yes, me, you are on, you are unmuted only. You are unmuted, me. Okay. Me, are you on the WhatsApp community group? I think your mic is having some issues because I cannot hear you despite you being unmuted. Uh, if you are on the WhatsApp community group, what you could do is you could maybe share those slips to on the group, because I think Tessie is on the group. Are you, Tessie?
Yes, please, I'm on the group.
All right. So me, if you're on the WhatsApp community group, you can share these tips to the group, and Tessie can definitely have a look at it, because I think you're having some mic issues, because it shows to me that you're unmuted. So if you are not on the group, you have my number here. You have my WhatsApp number here. Do drop me a message. I'll add you to the group as well. So I hope everything's clear for today. All right. Okay. So I hope everything's clear. You all had a wonderful time with the session. You all cleared your doubts out. Please do keep an eye out. We are going to have the sessions every 2 weeks. So not next week, next to next week, we'll be having another session. Do keep an eye out for the sessions. And as always, we look forward to having an interactive session with you all. Yes. Okay. So, yeah. So I hope everyone found today's session to be informative. I had a wonderful time interacting with all of you. Unfortunately, Mary had to leave due to certain commitments. She had to leave early. But definitely, if you're having any questions or would like a topic, specific topic to be discussed, please don't hesitate. You can drop me a message on WhatsApp, and definitely we will get back to you. We will arrange a session for it and we'll get back to you. All right. I hope you all have a good day, and thank you for today's session.